Ask the Doctor with Michael Lange begins in 2 minutes. Ask the Doctor with Michael Lange begins in 60 seconds. Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So pick up the phones and give me a call. Don't be shy. The phone numbers are 1-877-969-8600. If you're new to the program, who's Dr. Lange? Well, I'm a board-certified optometric physician, also a certified nutritional specialist, founded Lange Eye Care and Associates March 15th of 1993. We grew and opened 13 locations in the state of Florida. And I hail from the Lange Eye Institute now in the Villages, Florida. State-of-the-art eye care center in the Villages right there on County Road 101 and 466. Just a hop, skip, and a jump from wherever you are. We take care of just about every aspect of eye care downstairs. And then Michael Tolatino has his retina center upstairs. So any type of advanced retinal procedures and also a lot of clinical studies we're involved in upstairs inside the Lange Eye Institute. So if you'd like to see any of the doctors at the Lange Eye Institute for an eye evaluation or a second opinion, you can call, I'll give you this number twice, 352-753-4014. That's 352-753-4014. You can go to langeeyecare.com, or better yet, just go to my personal website, drmichaellange.com. From drmichaellange.com, it can go to all my other companies, Fortify Vitamins, Lange Eye Institute, Paleo Simplified, anything like that, Lange Racing. You can see from drmichaellange.com. Also, you can pick up a lot of our podcasts, our videos. You can go to just about any social media stream through drmichaellange.com. All right, so we've got a big show ahead of us today. We're going to let Doc Hall just a second chime in and tell you a little bit about what's going on in our show today. I see we're loading up with a lot of callers as well. So, Doc Hall, good morning. Welcome to the program.
Good morning, my friend. After last Saturday's Best of show, it's great to be live back on the air with you today and all of our listeners and our podcast viewers. Want to clear my throat there. Sorry. Special Mother's Day greeting I want to send out to all the moms out there. Remember, there's still time to show a bit of love to your moms in your life. Some flowers, maybe, dinner, even a phone call. That's all it takes. People always say, and I have to add this, people always say, Dr. Hall, Dr. Lang, we hear you talk about both of your moms all the time, and they're working out, they're taking vitamins. Is that true, or is that just radio talk? And folks, I assure you, it's very true. Just this morning, my mom called, and I'm going down to visit tomorrow, of course, for Mother's Day, and she asked me to pick up some heavier dumbbells for her on my way down. And, for a 93-year-old mom to call her son and say, hey, I need some dumbbells to work out with, it was a great thing. It really was. So, yes, that's all real. And God bless all the moms out there, and we love you all.
Yep, and don't forget to bring her an extra bottle of Fortify Fit.
Oh, absolutely. That it was funny, Dr. Lang, this morning. I said, what are you doing? And she said, well, I'm getting my radio ready to listen to you. And she says, and tell Dr. Lang I said hi. And I just happen to be sitting here drinking my Fit right before my workout. And so they really do use that, folks, and it works. I mean, it really does work. I mean, Michael and I both, Dr. Lang, we both love our moms very much. We're certainly not going to give them anything that's going to harm them. That would never happen. And we always want to do stuff that helps them. And so they're both on Fortify Fit. They're on Fortify Protein and the vitamins and the complete and like that. And also the focus. I would not let my mom go a day without taking her Fortify Focus. There's just no way. And also she takes the Omega Max, and she takes 2 of those a day. And I want to keep that mom going. And Dr. Lang does too. So best out there to all the moms again. And, show them a little love. And one thing you might want to do, although we can't get it to you in time for Mother's Day, is, you can let mom know that she has some vitamins or some protein or some Fit on the way to her. Call us up. We have some great deals going on right now. And this was we just put this together today, is we have free shipping. So all of you folks out there that have been, wanting to get in on something special, this is it. Shipping costs a lot of money. And for us and for the consumer, so this is free. We're taking that on us for right now. And so order up. It's free shipping.
You got it. Free shipping on Fortify.com. So just go to FORTIFEYE. Remember, it's a little play on words since I'm an eye doctor. Fortify.com. Free shipping. We got to compete against Amazon, right? And remember, it comes straight from our warehouse. Our warehouse is all air conditioned, 68 degrees. So you're not going to get anything that might be stored in a heated warehouse. So Fortify.com, free shipping for now until I say otherwise. So it's going to be free shipping maybe forever. You never know. All right, we're loading up. We got a lot of people on hold, so please hold just a little bit longer. I want to mention just a couple of things. Dr. Chris Costello is at the Lange Institute for about 6 months now. Dr. Costello is an optometric physician and ocular disease expert, doing a bang-up job. I mean, he's got amazing reviews because he's got a bedside demeanor kind of like mine. So if you want a great eye doctor in the Villages, Dr. Chris Costello. Also, the Upneek. This is an eye drop that makes your eyelids go up 35% on an average. It's amazing. It's taken off like gangbusters. So if you have baggy eyelids, you've been considering blepharoplasty or eyelid surgery, get in touch with your optometrist or ophthalmologist. You need a prescription for it, but it's called Upneek. You simply put 1 drop in your eye, 15, 20 minutes later, your eyelids go up about 33 to 35% or more. It works. If you got a dry eye, there's a new drop I've been talking about and promoting a lot lately called Optase, and it works. That's why I've been promoting it. Optase is amazing. It has a little more hyaluronic acid than everything else on the market. It's in a preservative-free dropper bottle. It's amazing. You can actually get it on our website at Fortify.com, at any of our nutrition centers at the Lange Eye Institute, and I think even over the counter now, and many eye doctors are starting to carry it. But you got to try Optase if you have dry eyes. All right. We got to go fast track this now because we got about 8 people on hold. So let's go to Bob. He's the first caller. Bob, good morning. Welcome to the program.
Good morning, doctors. Hey, plus it's Saturday. Good morning to you. I hope your trip to the mothership last week went as well as mine did a couple weeks ago. My question
we made it home
this morning, Dr. Lange. A couple years ago now, you fortified or your multivitamins. You took out zinc for those that had too much zinc or it wasn't compatible to them. And now with the COVID stuff going around, now zinc is one of the main components to fight the COVID. Now, with that all being said, could you tell me what negative effects too much zinc could have on male and or female?
Right. So many years ago, we were involved in some research and some studies doing DNA testing on our patients, especially patients with macular degeneration. All right. And we found out that a certain percentage of those, it's actually a fairly high percentage of patients, their DNA came back and showed that they had a negative reaction to the zinc, especially if they had certain alleles or certain DNA SNPs and they had macular degeneration. And so that's why this DNA study was done to prove that, what is in AREDS 2 formula is 80 milligrams of zinc, but that could potentially be too much zinc for many people based on their DNA. So the only way to know for sure is to have a swab done in the inside of your cheek and have a DNA test and sent out. So I took all of our zinc down to only 40 milligrams in a less harsh form called zinc monomethithione. And most of the studies and most nutritional gurus would actually agree that at 40 milligrams of zinc, that's a safe zone. So it's not going to be too much if you have the negative DNA, and it's enough to help, promote overall wellness, because zinc is very important for many reactions in the body. And, if you're not a vegetarian, you're probably not zinc deficient, because zinc is very high in many animal products, in milk and cheese and fish and meat, beef and chicken and things like that. And that's one reason I always recommend some form of animal protein. Obviously, if you're not going to eat any animal protein, you're going to have to get it elsewhere, and there's other ways of getting zinc. But that's why we do DNA testing oftentimes on our macular degeneration patients to see if they go to the zinc-free macular defense versus the regular macular defense, which only has 40 milligrams. So it's still in that safe zone.
Okay. But along with that being said, I personally still take the fortified complete with the zinc in it, but I also supplement with more zinc as a result of COVID.
Right. Yeah. You're fine. I think the complete just has, it's less than 40. I think it's got about 30 milligrams of zinc, somewhere around there if you take 2 a day. And you can certainly take a little extra zinc. But remember, I would not take more than 50 milligrams of zinc. I would tend to say at 40 milligrams or less. Because if you take too much zinc now, Bob, it screws up everything, and you're going to have to take copper. All right. Because if you take too much zinc, you become copper deficient. And so if you stay at 40 milligrams or less, you don't have to worry about the copper. If you take more than 40 milligrams, you're going to have to take a little copper. And then how much copper do you take? So as a rule of thumb, unless your doctor is recommending you taking more than 40 milligrams, I personally wouldn't. Okay?
Okay. All right. So 40 milligrams is the number.
Yep.
Dr. Lange?
All right, Bob. Yes, Doc Hall.
Yes.
I'm sorry. I just wanted to chime in just real quick. Want to remind folks that about your vitamins, your supplements, and like that, because I do consultations all week, and one of my requests is to bring in all of your vitamins, all your bottles. I don't want to know that you're written down on a piece of paper. I want to see them. I want to see what you're taking, and invariably I will get folks that'll come in and they're taking zinc from 10 different bottles. And found a lady a couple of weeks ago. You were talking about 40 milligrams as our top end that you and I recommend. And she was taking over 200 milligrams a day.
Yep.
And So it's real easy to do that because zinc is put in multivitamins, it's put in hair, skin, and nails formulas, it's put in a multitude of formulas. So just kind of check those. Or if you have any questions or anything, bring them in and let me see them or give me a call.
Absolutely. Thanks, Doc. And Doc Hall has free nutritional consultations. I mean, you do body weight index and everything free. Where can you see a PhD in clinical nutrition, certified nutritional specialist, sports nutritional specialist, an icon in the nutrition world for free? To go to the Lange Nutrition Center in Ocala, Florida. It is free. There's no gimmicks. There's no if, buts, ands. There's no copay. We don't charge your insurance. It's totally free. You can't beat that with a stick. All right, we're getting loaded up. Let's go to John. John, I apologize for making you hold for all that time. Welcome to the show.
Oh, thank you. Welcome. Good morning also. I've got a physiotherapeutic question. They have these cold lasers or LEDs that emit these frequencies that they say go underneath the skin and stimulate the nerves and the blood vessels to promote healing. And they work topically. Why could you use those directly over your eye? Because you have the direct access to the blood vessels and the nerves.
Yeah. I would not put that anywhere near your eye. All right. It is not a blue light. So blue light is very damaging to the eye, but any type of laser, even a cold laser, you got to be very, very careful with that. Now, if you want to do it around the paraorbital region, all right, like the skin around the eye, and you're with an expert that does this, and it's mainly for skin health, I think that's probably fine. There's a lot of different products out there that are helping to increase the collagen production to help minimize fine lines and wrinkles, but not on the eyeball itself. I don't know of any studies, and I'd have to have a retina specialist chime in on that. But I would not put it through anywhere near the eye unless it's around the paraorbital region and it's somebody that's done it before and they know what they're doing. Because there's a lot of things out there, a lot of laser technology that can damage the eye. I mean, there's so many different lasers. You have cold lasers, you have thermal lasers, you have infrared lasers, you have YAG lasers, you have argon lasers. There's so many different lasers. And many lasers we actually use therapeutically in the eye for blocking irregular blood vessel growth and stopping bleeding and things of this nature. But we're trying to get away from lasers because the way the laser works in the eye, it destroys areas that are leaking. And so if it's not pinpoint exactly, you can destroy a part of the retina that you see with. And so this is why the big thing now is anti-VEGF nutrition, anti-VEGF injections. These are injections in the eye that have anti-VEGF, anti-vascular endothelial growth factor, and they help stop these irregular blood vessels from growing, and those are the ones that leak. And then therefore you don't have to use the lasers. So I don't know if that answered your question a roundabout way or just kind of skip the topic or not.
Well, the reason I'm asking, my aunt has got wet MD, and she's getting, these interval injections into the eye.
Right.
And we got her started on all your nutrients on your program.
Right.
And being as old as she is, just a simple, nice hot pack helped her with her sore muscles and all. But
right.
I did pick her up an LED pad, so she could put her feet on there and stimulate the blood vessels to promote circulation. And it hit me. I said, well, why couldn't you use this right over the eye and maybe it would help with your condition that you have? And I said, oh, I know who I'm going to call.
Well,
but
John, I would say, John, that heat on the eye is fine because the heat can actually help open the meibomian glands. And as we mature, the meibomian glands become blocked, and that causes a secondary dry eye. And if you have macular degeneration with dry eye on top of it, that compounds the problem and causes your vision to be very foggy. Remember, macular degeneration steals your central vision, and then dry eye can make an overall dimming of your vision. So a hot compress or even any type of element that heats up that can rest on your eyes when they're closed, that's good for the lid margins and it's good for dry eye, but it's not going to help. It's not going to help the macular degeneration.
Right. Oh, well, she's got the wet type, whatever that is. I'm not real familiar,
Right.
but on her scenario, she's also come down with AFib, and she's got a medication that basically makes her feel bad all the time. And And I asked her, well, did they put you on potassium or magnesium or any other elements? And they said no. They just said try to deal with the medication.
Right.
Are there any nutrients she could take?
Well,
help,
AFib is a whole different radio show that we could go the whole show on. So the good thing about AFib, nobody dies from AFib. However, if AFib's not under control, you can throw a stroke, and you can throw a stroke in the eye or the brain, or you can have heart problems. So you got to keep AFib under control. And obviously, I recommend avoiding anything that's caffeinated, any type of diet drinks, any type of coffee or even tea. Magnesium, but potassium, I usually recommend eating an avocado, a handful of sprouted seeds, all right, an avocado and or a banana daily, because then you're going to get the magnesium, you're going to get the potassium, because some deficiencies in that can create issues. Dehydration is a culprit for atrial fibrillation. So make sure she's drinking enough water, all right? Believe it or not, add a little coconut water. Coconut water is also high in these electrolytes that if you're deficient may increase your risk of AFib, all right? So make sure she's not dehydrated. Make sure she's getting plenty of sleep. If you're sleep deprived, you're more likely to have AFib. If you have high blood pressure, you're more likely to have AFib. I would get her on just a clean diet, obviously a clean diet, plenty of rest, plenty of hydration, maybe a handful of sprouted nuts and seeds, a banana and avocado, and obviously follow her cardiologist's advice. And yes, there's a lot of medications they put you on. They put you on like amiodarone, cardarone, or pacerone, which can actually build up in the cornea. So it's important to see your optometrist and ophthalmologist. And they put you on a beta blocker that makes you very tired. And then they'll put you on some sort of a blood thinner, if you will, whether it's a baby aspirin or it's Plavix, it's Coumadin, it's Xarelto or Eliquis or something of this nature. So that's usually the combination. And then there's other things that can be done for AFib, as you may be aware of. There are other procedures that can be done if they can't control it naturally or medically. So try to do the things that I went over with really quickly, and obviously follow the advice of her cardiologist.
Great. Appreciate it. You guys have a great weekend.
All right, John, take care.
And happy day to all those mothers out there.
Thank you. Once again, happy Mother's Day. If my mother's listening, my mom was still asleep when I left. Usually she gets up. And I let her sleep in late. I'll fix breakfast on the way back. And folks, I'll be at the Fortify Nutrition Center today from about 11:15 to 12:15, maybe to 1 o'clock. But I'll be there for at least an hour. Then I'm going to get my mom and Miss Nita, my assistant mom, my mother-in-law, and we're going to take them out to the beach, Clearwater Beach, and hang out for a few days. All right, let's go back to the phones. We've got Bart in Sarasota. He's been holding a long time. Bart, thanks for holding.
Thank you, doctor. I heard you talking about lasers. I had laser for narrow angle glaucoma, and one eye I had like 3 zaps of the laser. It was okay. The other one, they went in from the side and did about 10 zaps, and that's about 6 months ago. And since then, I've had pretty much pain in that same eye. Where they had the 10 zaps, and I just wondered, can you get too much laser? Can that harm you?
Yeah, that type of laser is usually pretty safe, Bart, especially in the hands of a competent ophthalmologist that's doing this. I mean, the chances of you having a serious problem from that is pretty slim. I would say if you're really having a lot of pain, you need to get back and see the ophthalmologist that did it. First I would try, believe it or not, just using a good lubricant like the one I just mentioned, Optase, all right, or Oasis, Fresh Coat. These are all good. Retain. Those are my top 4 lubricants. So they're all pretty good. I think Optase is taking the #1 rank in my opinion right now. So Optase, Oasis, Fresh Coat, or Retain. I think we have all those on our website at fortify.com, and some of those you can buy over the counter as well if you're down in Sarasota. And remember, if you buy them on our website now, we're doing free shipping on everything, and you usually you'll get it in a day or two. So that's something to think about. But I don't think you probably, without seeing it, I can't tell you definitively, but we've done thousands of those over the years through the Lange Eye Institute, and I've never seen anybody have any serious complications from that. So if you try the lubricating eye drop, because most pain in the eye can be associated with dryness, believe it or not. But other things can be a problem. If you try the artificial tears and you still have the pain, get in to see your eye doctor and find out what's going on.
Well, I have done that, and then they put me on a series of Lotamax, and then they went to prednisol drops,
Right.
and none of that really worked. And that pressure in that one eye stays around like 28 to 32, and they've tried a lot of different stuff. So, and they sent me to 2 other doctors, and I've still got that. Plus, it's kind of dark red in the corner.
Right.
And,
Yes. So
strange.
if your pressure is, knocking above 30, yes, you
Mhm.
can definitely have some pain that's associated with that. That's not related. And the steroids, it sounds like you may have a inflammatory problem. That's why they put you on the steroids, and that's kind of a catch-22 because you can also be a
Mhm.
steroid responder. So they got to lower the inflammation with the steroids, but many people react to the steroids and make your pressure go up higher. So it's probably
Right.
time to try a combination of different topical medications. Sometimes I got to give you oral medications. I'm just going to throw one out there that you might have tried, they might not have tried, but they can give you a
Yes.
sample. And a lot of times it's expensive. That's why they don't try it. It's called Rocklatan. Okay, Rocklatan. That's a combination of Rocklatan, just the way it sounds, Rocklatan. Ask them. I mean, I'm not telling them how to practice, but a lot of times they don't try it because it's expensive. But I've had a lot of patients that we've tried just about everything, and until we put them on the Rocklatan, it didn't work, and we got some amazing results. It's a fairly new generation medication. It has a multiple modes of action. It's very safe, and it works. It can make your eyes a little red, but that's a minimal problem, especially if you bring the pressure down. So they probably already tried it. If they haven't, just throw that out. Say, hey, I heard Dr. Lange talking about Rocklatan on the radio. Is it an option for me or not? Okay.
Thank you so much, Doctor. I appreciate it.
All right, Bart. Keep us posted.
Okay. Bye-bye.
All right, you're listening to Ask the Doctors. It's myself, Dr. Michael Lange, with my co-host Doc Hall, and it's the day before Mother's Day. So once again, happy Mother's Day to everybody. Before we take the next caller, I just want to mention, summer is here, right? Summer's here. And remember that old advertisement, can you pinch an inch? Well, a lot of us can pinch a lot more than an inch, right? So if you can pinch a lot more than an inch, maybe it's time to start taking some weight off, right? But everybody's tried all these diets out there to no avail, right? Or you take the weight off and then it comes right back on. And a lot of these diets can be very actually toxic to you and not healthy. So I developed something called the Fortify Healthy Weight Loss Bundle. It's a bundle. It's on fortify.com, and it's a combination of our organic blue-green superfood, one of our proteins, our enzymes, and our probiotics. And we've seen this work synergistically together and help people lose weight, some dramatically. You use this as a meal replacement, okay? So you take this, the collagen, the superfood and the protein, shake it up in water, take the probiotics and enzymes, boom, and you use that as a meal, and you will lose weight because you're going to have less calories. It has some things in there that help you to lose weight. But go to fortify.com, go to the Healthy Weight Loss Bundle, read the information I have on there. When you combine that along with the Lange Survival Diet for the other 2 meals, you're a fat-burning anti-aging machine. Now, Doc Hall and I talked about this on the car drive on the way in. The problem is when you lose weight, if you lose weight relatively quickly, and why do you lose weight? You lose weight because you want to look better, right? You want to be healthier, but you want to look better. But then all of a sudden you have these wrinkles all over your body. You look at your biceps and your thighs and your tummy, and you got all these really weird wrinkles. So that's why we have to build muscle and take the nutrients that give you proper skin health. So either A, Fortify Fit, that helps you to build muscle to fill out that saggy skin, and it has the collagen, the astaxanthin that's amazing for the skin, or our new Collagen Plus. One little scoop, shake it up, drink it down once or twice a day. That's peach ceramides, hyaluronic acid, and collagen also helps the skin. So the Healthy Weight Loss Bundle is a good way to lose weight, and then adding some of these other things to help improve skin integrity. Doc, before we take the next call, you want to chime in a little bit about that? That's kind of a catch-22. We lose weight to look better, but sometimes with minimal clothes on, a tank top, our arms look really wrinkly, right? So we got to do something about that too.
Absolutely. Just a couple of real quick points here, and to really support what you just said, I want to remind everybody that weight loss is not just about losing pounds. Of course, that's our ultimate goal, but there are several other factors and for you to consider to make this weight loss the success that you hope and want it to be. First of all, as you lose weight, you don't want to lose muscle. Okay, and that happens a lot of times. We get so focused on just that scale. Okay, I want to go down another pound, another 5 pounds, another 10 pounds. We lose muscle along the way. We don't want to do that. Okay, muscle helps us get from point A to point B. All right, it enables us to stand up and not, as we get older, fall and do those kind of things. So we have to keep that muscle integrity going. Best way to do that, as you said, our bundles there. And also our protein, our special formula that we love, Fit, which is just unreal success that we've had with that. It's almost too much for words. One thing I would like to say though too, before I get to this other point, is the reason folks would do bundles is not just to sell more products. It's that a bundle is a synergy. Okay, the products work together. Product A works good with product B. That's why we put them together. And they just work better in the body. And that key word there is synergy. So that's why we do that. And so when you're really looking to focus in on a particular area, if it's eye care, if it's skin care, if it's weight loss, if it's bodybuilding, we have bundles for all those because our products work well with each other. The other point I want to make real quick, as Dr. Lange said, you know, as we gained weight over the years, our skin accommodates that weight gain. It stretches, it gives, but also as we get older, the elasticity in our skin, it kind of diminishes. It goes away. It decreases every year. That's what's, as I say, is like what's in a rubber band. It lets the rubber band come and go, okay? And we lose that. However, we can help that along as we're losing weight because what we want to do is, I call it, shrink wrap the skin back around the muscle. You know, you can lose all this weight, but if you have saggy skin and all these little wrinkles and crinkles in there, you know, it's not the result that you really wanted. So we have to work from the inside out, the outside in. We're working on a 2-pack type of thing now where we have a topical cream, and we also, of course, have our Collagen Plus, and I would definitely advise that. It's worthwhile to do. It really is.
All right, Doc, thanks for chiming in there. You're listening to Ask the Doctors. If you got a question, give us a call. This is the day before Mother's Day, so moms, you got to get warmed up to have a great time tomorrow. Maybe start partying today. 1-877-969-8600. 1-877-969-8600. I want to shout out to my lovely bride, Tammy and Mackenzie. They're in Denver, Colorado right now at a big volleyball tournament. You know, they play all over the country, and they only allow one parent in because of this whole thing going on. So I wasn't able to go, but I'm here to do the show. So shout out to them. Good luck. Mackenzie's team is ranked #1 in the state of Florida, and they just got second place in the beach volleyball tournament. Calvary, I got to congratulate, lost in overtime, would have been state champions, but the Calvary High School, Mackenzie's beach volleyball team, they got second place in the state at state championship last weekend. So volleyball extraordinaires. All right, we're going back to the phones. Barbara's been waiting patiently. 17 minutes she's been waiting. And we got a lot of other people on hold, too. Barbara, thanks for holding. Good morning.
Good morning to you, and it's worth getting to get to talk to you.
Thank
I just
you.
wanted to really congratulate you and thank you and Tammy, for your vision, for your caring. You're two of the most caring, genuine people I think I've ever met. When it comes to just all around the way you take care of your mother, the way you take care of Miss Nita, you know, as they say, the proof is in the pudding. But I want to thank you and Tammy so much for opening this your store. I had the privilege of spending quite a bit of time in there the other day. I took my 91-year-old mother, and she didn't even want to leave. People congregated in that store. And I met some of the most lovely individuals, and there's a different group of people when they really care about their health, they really care about their body, things really fall into place, and God, of course, is always at the top of that. And but the strength and the knowledge that we gained that day, Arlene, she answered questions that people had. People have such a misunderstanding of fish oils and different all the different products. There's so much misleading information out there. But to go to a place that you feel the love and you feel the caring and you feel the time. She took so much time with each individual person. And people that had some very, very disconcerting things about the climate of what we're going through right now. And there was even a couple that came in and asked if we could pray. And anyway, I just want to thank you. Tammy and Arlene are two of the hardest working women. And of course, behind every great man, there is a great woman, and you certainly do have a great bride there. But I just wanted to give a shout out and thank you so much for having the vision and making a place where people can go and have a haven of rest and really find out real, true nutritional value. Thanks so much.
Well, thank you, Barbara. I appreciate that. My head's going to be too big to get out of the door. And I do have to say, Tammy's an amazing woman. I'm a lucky man to have such a great bride, and that's absolutely correct. Behind every man is a great woman, and maybe vice versa. So I appreciate that positive feedback. All right, you're listening to Ask the Doctor. 1-877-969-8600. Let me give you the phone number for Fortify Vitamins, and then I'm going to give you the location for our new Fortify Nutrition Center in Clearwater. Fortify Vitamins phone number, I'm going to give it to you twice. Get a pen and a piece of paper. 866-503-9746. That's 866-503-9746. And if you want to have an appointment to see Dr. Hall in Ocala for that free nutritional consultation at the Lange Nutrition Center, right there on State Road 200 across from the mall, large 2-story building, go up the elevator. You can't miss it. You can call that number and they'll put you through or give you his number, and he's going to give it to you again in a minute. So the phone number is 866-503-9746. Fortify Nutrition Center in Clearwater is located on McMullen Booth Road, Clearwater, Florida. That's Bayside Bridge Plaza. Bayside Bridge Plaza. That's where Publix is. Can't miss it. It says Fortify Nutrition Center. I'll be there today about 11:15. For an hour, maybe 2 hours, talking nutrition to everybody that wants to come in. And Arlene does a great job. Tammy's behind the scenes there. Miss Need is behind the scenes there. So it's a great center. And like I said, Doc Hall runs a smooth sailing ship at the Lange Nutrition Center in Clearwater, and he's going to give you that phone number in 1 second. But let's go to Fred first. Fred in Dunellen. Good morning. Fred.
How you doing?
Good. How you doing?
Good. Okay, the reason I'm calling, 2 years ago I started having trouble with my eyes. It kept getting worse. And then one day, a couple months ago, my eyes were really hurting, like I had sandpaper in them, and I went to the eye doctor. And they pulled a bunch of filaments out of my eyes. Mm-hmm. And she said that was pretty rare. And they sent me for some blood tests, and they tested me for Sjogren's, and the test came back negative for Sjogren's, high rheumatoid factor. They send me to a rheumatologist who retests me for Sjogren's and some other things and says I have Sjogren's disease. And I haven't been back for my follow-up appointment on that, but you know how you like do research and try and figure out stuff on your own. I guess it's an autoimmune, and I was just wondering what the prognosis is and what possible treatments going forward are for something like that.
Right. Yeah, it's a great question. You're my typical patient, Fred. I mean, I see a lot of patients, average age patients, 82. They all have this condition, all right? And so basically, you could have a mild case of what we call filamentary keratitis or just plain old keratoconjunctivitis sicca. It's a big word to mean dry eye syndrome. So this is an area that I'm an expert in, and I like a natural approach first. So what I always tell patients is, and you can learn about this at fortify.com because I have a whole section on dry eye. It will go over what I'm telling you now, but we heat the lids, we clean the lids. So we heat them up with hot washcloth or something called the Bruder mask. When we heat the glands up, it opens the meibomian glands and secretes the outer lipid layer of the tear film, which is crucial for dry eye. We lubricate with a good lubricating eye drop. And I mentioned 4 of them that I like. They're all on the Fortify website. You can get them through your eye doctor. Optase is the newest one. It seems to last a little longer than the other ones. But the other ones, the Fresh Coat, the Oasis, those are also very good. But I tend to like Optase a tad bit better right now. So we heat them, we clean them. You can clean them with baby shampoo, or you can buy one of the special cleaners over the counter, and we have a bunch of those on the website as well. So we clean them to get rid of the bacteria that clogs the glands. So once again, we heat them, we clean them, we lubricate them, and then we nutrify them. Just one nutrient for dry eye that works the best is omega-3 fish oil. You got to make sure it's the triglyceride molecule. Don't get krill oil. It won't help. It's not potent enough. So triglyceride form, Fortify Super Omega, or better yet, Fortify Super Omega Max. You take 2 a day. That can help as well. The other piece of the puzzle from a nutritional standpoint is adding astaxanthin from our Fortify Focus. And there's some good clinical studies that are on our website showing that astaxanthin can help dry eye, and GLA from black currant seed oil. And I put all of that together, and Fred, into one thing I'm holding up for social media to see. It's called Fortify Advanced Dry Eye Therapy Blue Light Shield. So that makes it simple. It's a bundle. It's free shipping. It's not that expensive. It's called Fortify Advanced Dry Eye Therapy. It has the omega-3, the black currant seed oil, the astaxanthin, the lutein, and the zeaxanthin all in it, and it does work. But remember, it's a combination of those 4 things. Heat them, clean them, lubricate them, and then nutrify them. If that still is a problem, then you talk to your optometrist or ophthalmologist about putting punctal plugs in, little plastic kind of silicone plugs in your drainage ducts. And that's kind of synonymous with putting a stopper in the bathtub. Put a stopper in the bathtub, the water stays in the tub. We put a stopper in your drain, your tears stay on their eye a lot longer. It's covered by your insurance. It takes literally 30 seconds to do. You don't even need an anesthetic. It's totally painless. So that's called punctal occlusion for dry eye. Then, if you still have dry eyes, then you want to have a procedure done. Either one I like that we do is called iLux. iLux is a little procedure. We heat the glands up, and then this machine squeezes the glands, and so it gets rid of these blocked glands. If you truly have blocked glands, and the doctor will determine if that's the case. And then the final piece of this puzzle is stem cells from an amniotic membrane. So there's a lot of different amniotic membranes. They put it on your eye like a contact lens. You leave it in 3 to 5 days. And this combination usually helps dry eye dramatically. And there's certainly medications that can be prescribed, dry eye medications, and there's steroids and things that can be prescribed too. And it's up to your doctor. But I always start my patients on this protocol first before going to any drugs.
Fortified Advanced what?
Oh, it's called Fortify Advanced Dry Eye Therapy. Fortify Advanced Dry Eye Therapy. And that's
That's the package you can order.
Yeah, that's the package you can order. And remember, nothing works instantly. But I would tell you, if you give it a couple of months, most of my patients, if they do the other things I just recommended, do extremely well. And the good thing about this, it helps inflammation in your body. So if you have a little joint pain, if you have dry skin, it can help with your skin. It can help with joint pain. And it also helps your vascular system. The nutrients in this have been shown to help with triglycerides and cholesterol and C-reactive protein. So I call it an anti-aging nutrient. I don't have dry eye, but I take this pack just for the other health aspects, okay?
Yeah, I'm extremely dry. I mean, I wake up in the middle of the night, my mouth is like sandpaper.
Yep.
Isn't Sjogren's like an autoimmune?
Absolutely. It's goes hand in hand with autoimmune and collagen vascular diseases. Rheumatologist is somebody you definitely need to see for this. Make sure you're drinking enough fluids.
Yeah.
And I talked to somebody about atrial fibrillation earlier, saying eat an avocado and a banana. That's probably a good idea, because if you're potassium deficient, it aggravates a dry eye. So eat a banana, drink plenty of good water, all right? Maybe a little coconut water, and try the things we talked about, and then follow the advice of your doctor, or I'm always happy to see you at the Lange Eye Institute.
Is there anything on your website that talks about all this? Because
Yeah.
it's a lot to remember.
Yes, absolutely. Just go to fortify.com, FORTIFEYE, fortify.com, and there's a whole section on dry eye on there, okay?
So the prognosis is pretty good, right?
Ah, absolutely. You're going to do fine. If you do the things I recommend and to do things your doctors say, you're going to do okay. This is a little bump in the road, but it is totally manageable, okay?
I guess it's progressive, though, isn't it?
It can be progressive. That's why we want to nip it in the butt now early, because you're still pretty young. You don't want to. You don't want it to compound and get worse and worse and worse, because it's like a snowball. If we don't stop it now, it will be more difficult to get a good grip on it. So now's the time to initiate these type of treatments.
All right. Well, thank you, Doc.
All right, Fred. Take care. All right, we're going to go fast track this because we got a lot of people on hold. Linda in Ocala, thanks for holding. Good morning.
Good morning. I just wanted to know, can you take too much lutein?
It's very difficult. All the safety studies on lutein have shown it's been very, very safe. I mean, they were taking over 100 milligrams a day. But, I mean, I have many patients that take 20 to 40 milligrams of lutein with no problems at all. So it's very difficult to OD. Now, you don't need to take, if they say take 2 pills, you don't need to take 20 pills, okay?
No, I'm just taking 38 milligrams because I take one macular defense and then I take 20 of a separate one. I think it's Nature's Plus or something.
Oh, that's fine. That's absolutely fine.
Okay.
And remember, don't take any beta carotene with that. Don't eat any carrots or sweet potatoes within 2 to 3 hours of taking your supplement.
Okay.
All right?
Okay, thank you.
Okay. Jerry in Gainesville, thanks for holding. We got to go rapidly.
Did you hear that scientists have discovered a new treatment for apathy?
Okay, tell me what that is.
So far, nobody cares.
I think I got an email from somebody about that. Maybe that was you.
That was me.
How are you?
I'm good.
Good. You ready?
Go your next caller.
Oh, you ready for a good Mother's Day?
Yes, I am.
Outstanding. All right. Thanks for that. Any eye questions or anything?
No, I'm loaded up with all your products. Take them every day.
All right, Jerry. How's Gainesville? Is the weather up there a little cool this morning?
It's cool. It's cool this morning. Yeah.
All right. It's going to be a beautiful day.
Yep.
Dr. Lange?
Yes.
I just wanted to throw in something real quick. I know we're short on time here, but just to go back over 2 things, the Upneek and also the iLux. I've had both of those procedures. I think I'm the chief guinea pig. I don't know. but when I walk into your office, you always say, Doc, come here. We got to try this. And I'm the one to try it. But anyway, just real quick, last weekend I served in my capacity as commissioner for the PCA Bodybuilding Association. Huge, big event over in Tampa. As such, I was on the stage as the MC, lots of photos and video and like that. So I wanted to look my best, of course. I'm representing the PCA. I'm representing Fortified Nutrition. So I want to look good. I used the Upneek the morning of the bodybuilding show, just a drop in each eye. And it was like an instant eyelid lift. It was amazing. Yeah, very easy. No burning, no pain, no nothing, no after effects. Highly recommend. Also, the iLux, I did that procedure probably about a year ago.
Right.
It was amazing too. No pain, no nothing. And the results of the end of it were spectacular.
Right.
And just why I'm on here, I just want to say again, happy Mother's Day to everybody. Be kind to others, be kind to yourself, and please, folks, be safe. Thanks for tuning in, and tune in next week. And back to you, Dr. Lange.
All right. And actually, we have more time than I expected. I think we got 2 minutes and 52 seconds. Wow. We got extra time here. But Doc is our guinea pig. He really is. And he's always happy to oblige me. The iLux procedure is made by Alcon. And this is a procedure where we actually take a machine or an apparatus, a handheld machine that sort of clamps on your lids and heats them up and then squeezes them gently. It's not painful and it works. So it opens up the meibomian glands. So people that have meibomian gland dysfunction, and that's causing their dry eye, it helps them dramatically. Now, it is not covered by Medicare or insurances, so it's an out-of-pocket expense. It's $599, but I got to tell you, it works in the majority of cases dramatically. And there's other procedures that people do and doctors do that are similar to it that are more expensive and some less expensive. But iLux is the one that I recommend. I did a lot of research on it. It works quite well. But I always tell my dry eye patients, and we always try to do the natural approach for dry eye first, where we heat the lids, we clean the lids, we lubricate the eyes, and we nutrify the glands and the body, what we talked about with that other caller just a minute ago, before we do the iLux. And there are medications that we can prescribe as well. And some of these medications work quite well. Some of them can be very expensive and they're not covered by insurance. And I've got a very high percentage of success rate doing a natural approach for dry eye. So check it out on the website. Advanced Dry Eye Therapy is the one I recommend. Advanced Dry Eye Therapy. It has a lot of other benefits. Look at all the studies on the website. Go to fortify.com. That's FORTIFEYE, fortify.com. And remember, all of you that want to lose weight now for the summer, check out our Healthy Weight Loss Bundle. And remember, all free shipping now at fortify.com. We started that yesterday. Fortify.com, free shipping. Remember, I'll be at the Fortify Nutrition Center today at McMullen Booth Road from about 11:15, maybe for 2 hours, give or take. And then I'm going to take Mom out to the beach, and we're going to get a little vitamin D. So I want to thank everybody for tuning in. I want to thank Doc Hall for being a co-host this morning. And like I said, very happy Mother's Day tomorrow for everybody out there. If you're not happy with the eye care that you're getting, get a second opinion. Come to see us at the Lange Eye Institute. And remember to check out all of our bundle deals at fortify.com. With that, I'm out of here. Have a great day. God bless you, and God bless America.